spread to people from the saliva of infected animals. The rabies virus is usually transmitted through bite. Animal most likely to transmit rabies in the United States include birds, foxes, so many animals. Now in developing country, we know about developing country is mainly stray dogs are the most likely to spread rabies to people. Once a person being showing signs and symptoms of rabies, the disease nearly always cause death. No, we know about the causes. The rabies virus causes rabies infection. The virus is spread through the saliva of infected animal. Infected animal can spread the virus by biting another animal or a person. Huh? In rare cases, rabies can be spread when infected saliva goes into an open wound or vision mentioned, such as eyes or mouth. Now, uh, next slide. Next slide. Back. Here we see rabies virus encoded by the structural protein. A structure of virus. Uh, Here we can see structures of rabies virus. Rabies virus are negative standard RNA virus belong to the genus Lisha virus of the Rhabdoviridae family. Rabies virus is characteristic by rod or blunt shape. The nucleocapsid is spirally symmetrical. The surface has an envelope and it contains single standard RNA. We can see here all rabies virus included 5 structural protein. First, we can see N protein, nucleoprotein, P, phosphoprotein, M, matrix protein, G, glycoprotein, and RNA, direct RNA polymer. G protein is the most major antigen in the formation of neutralizing antibodies, rabies virus. After that, we can see next slide, epidemiology. It causes tens of thousands of deaths every year, mainly in Asia and Africa, where you can see 40% of whom are children under 15 years of age. Dogs are the main source of human rabies death, contributing up to 99% of all rabies transmission to humans. Now here is globally 59,000 rabies deaths per year. In India, 20,000 rabies deaths per year. 91% deaths in rural area. Already told rabies is 100% fatal, but 100% vaccine preventable disease. Evolution of rabies vaccines. First rabies vaccine evaluated by Louis Pasteur developed the earliest effective vaccine against rabies that was first used to treat a human bite vaccine victim of 6 July 1885. The method involved in occupation with homogeneous of rabies infected rabbit, a spinal cord that had been digested progressive in sterile air. Now we can see 8085 live attenuated vaccines, spinal cord, non-standardized dried preparations. It's cause nervous systems, inactivated vaccines, brain up to 10%, minimal neural contact liquid preparation in 1976 cell culture, inactivated vaccine, cell culture 2.5 per unit, international unit, standardized immunogenicity, lyophilized up to in in 1885 we given up to 31 injections, in 1911 we given 14 injections, and in 1976 we given 5 injections, 0.5 to 0.1 ml. Here we see current rabies vaccines are cell culture vaccines. Inactivated vaccines are more than 50 years old technology. Inconsistency, potency, stability, short supply, adverse event, decreased compliance beyond 3 injections. Next generation decreased compliance beyond 3 injections. Now meeting the unmet medical need, introducing a novel vaccines with simple and shorter regime. Here we can see first vaccine with 3 dose intramuscular regime 0, 3 and 7 days. First protein subunit vaccines prepared by VLP platform technology, better compliance due to easy to flow regime and less visits, convenience, ready to use, no reconstitution. G protein is difficult to stabilize. G protein isolations using VLP technology, purified and stabilized by Cadila Pharmaceuticals Limited. Virus-like particles VLP are protein complex exist as neoplast neo neo neoparticles. VLPs are similar to native virus particles, but that do not contain the viral genome. They cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and cellular immune response. VLP as a vaccine. This recognized by Cadila Pharma. Next slide. Original research article, a novel recombinant rabies G protein vaccine, Thravis, a VLP based rabies vaccines. We can see on article Dr. Sumit Podar, Dr. Ashok Agrawal, and Dr. Amit Soni, Dr. Seema Sharma. Safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccines administered as simulated post-exposure immunizations, a randomized comparator controller multi-center phase 3rd clinical study. This is Thravis. The evaluate immunogenicity and safety of rabies G protein vaccine administered as a Original research article, a novel recombinant rabies Z protein vaccine, Travis, a VLP-based rabies vaccines. We can see Dr. Sumit Padar, Dr. Ashok Agrawal, Dr. Amit Sonia, Dr. Seema Sharma, who given about this. Now, next slide. Travis vaccines, we can see here safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies Z protein vaccine administered as a simulated post-exposure immunization, a randomized comparator controlled multi-center phase 3 clinical study. The evaluation, the elevated immunogenicity and safety of rabies Z protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. Randomized comparative control multi-centric study. Total subject 800. Randomized 2:1. Travis 037 days only regime. No, 533 subjects, 267 subjects, and here you can see 037 14 28 days regime. There for reference. So Travis we can only given 3 doses 037. To demonstrate non-inferiority of the test vaccine to comparator vaccines. To demonstrate non-inferiority to the test vaccine to the comparative vaccines, primary objects, here you can see subjects with seroprotections at 14 days post first days. Seroprotections are we in a titer more than 0.5 international unit per ml. And to demonstrate non-inferiority of the test vaccine to comparator vaccines, primary objects, subjects with seroprotection at 14 days post first dose. Secondary objects, subjects with seroprotection at day 42 post first dose of test vaccine, safety by monitoring of subjects and adverse events. Seroprotections, the protection obtained by vaccinations. Efficacy and safety. For safety data, about 9.9% subject in recombinant rabies Z protein vaccines and 70.2% subject of reference arm reported adverse event. All the adverse events were mild to moderate in nature, which resolved without any complication. The most frequently observed local AEs were pain, redness, and swelling at the injection sites. The systematic AEs were fever, headache, ear pain, urticaria, joint pain, and nausea. None of the study subjects in either groups discontinued the vaccination course due to AES and no death. Serious AE or anaphylactic reaction was observed during the entire study. The compliance to complete course of vaccination was 99.5% among the 800 participants. All the study subjects were healthy up to day 365 in both the arms. Therapy has a better safety profile compared to reference vaccine. 0% adverse events. Now, efficacy. The results were constituent across different and age and genders, observed different 1.52% with the pre-specified margin of 4%. Non-inferiority of seroprotein primary endpoint day 14 and 42 were not met. Test and comparator are identically in seroprotection rate both on days 14 and 42. Therapies has better safety profiles compared to reference vaccine. Next. Therapies was non-inferior to reference vaccines, less advanced effect, less adverse effect compared to reference vaccines. Novel 3 days therapies was found to be safe and immunogenic and was compared to 5 doses of WHO pre-qualified vaccine. Pharma Invention of the Year by the Economic Times, the Golden Globe Tigers Award, Malaysia for Invention of Product of the Year, Innovative Product of the Year. So Theravis is very good vaccine for rabies disease, and we can use less doses and very effective, no side effect. We can see here we can discuss about the rabies prescribing information. Each 0.5 ml vial contains rabies G protein 500 microgram, disodium hydrogen phosphate, anhydrous IP 0.87 mg, monobasic sodium phosphate monohydrate BP 0.88 mg, sodium chloride IP 8.76 mg, and tergitone NP9 0.1, sodium hydroxide QS. Correction of 5 using rabies Z protein in terms of potency. The rabies Z protein vaccine is subunit vaccine where purified rabies Z protein is active constituent. The strength of vaccine on label is represented in micrograms per dose, which is potent enough to generate more than 0.5 international unit per ml. Anti-rabies neutralized antibody threshold for seroprotection. The micrograms per dose of vaccine strength is also correlated in house with international unit per dose by comparing the other of the test vaccines with that of the reference vaccine. National reference standard for rabies vaccine calibrate in international unit following the NIH mouse neutralization test as a described in laboratory technology in rabies. 10 micrograms of rabies Z protein is to be equivalent to 1 international. Hence, each single human dose of rabies contains more than 2.5 international dose of vaccines. No added for rabies vaccines, no added preservative. Rabies vaccine contain no preservative and should be used immediately after opening of vial. The preservative in the vaccine dose may cause deleterious effect on the antigen and impair the safety to the product in humans. The limit of the use of preservative should be approved by the National Regulatory Authority. Packing information 0.5 ml in glass vial. Storage and handling instruction: store at +2 to +8 degree Celsius. Do not freeze. Therapeutic indication: indicate for the immunization against rabies. Method of administration: what is the method of administration of rabies vaccine? Rabies Z protein vaccine should be administered as single 0.5 ml intramuscular injection in the region of the deltoid muscles. Route IM. Volume 0.5 ml. Regime 3 dose. Vaccination schedule: first dose day 0, second dose day 3rd, third dose day 7. Do not mix with other vaccine in the same syringe or vial. Contraindications: rabies vaccine is contraindicated in individual with no history of severe hypersensitivity reaction to the vaccine or to any the expedient listed. A special warning and precaution for users: do not administer it by intravascular, intradermal route. Do not use the vaccine after the expiry date. Drug interaction: the response to the vaccination may be reduced in patient receiving immunosuppressive therapy or with congenital or acquired immunodeficiency. Concomitant use of immunosuppressant, anti-malarial drug treatment after exposure should be avoided unless necessary. Use in special populations. Pregnancy and lactation: rabies has no prior experience to use in pregnant and lactating female. Effect on ability to drive and use the machines: no study on the effects on the ability to drive and use machines have been performed with rabies vaccines. Undesirable: the most commonly reported adverse reactions were mild and transient in nature. Rabies vaccines has been evaluated for safety and immunogenicity in phase 1st and 2nd and phase 3rd clinical study in Indian population by Cadila Pharmaceuticals Limited, India. Rabies vaccines was found to be safe and immunogenic in all clinical trials. We can see in trial report, phase 1 clinical trial, out of total 170 subjects, 56 subjects reported AS and headache was the most frequent AE, followed by the muscle pain and trends. In this study, one patient reported a serious adverse event, abscess at penoscrotal junctions, which was unrelated study vaccines and resolved with medications. Most frequent body symptoms affected by AS were general disorder and administration site condition, 11% subjects; musculoskeletal and connective tissue disorder, 11% subjects; and gastrointestinal disorder, 11% subjects. And in second phase trial, we can see no anaphylactic reaction was reported phase 2nd. Out of total 225 subjects, 40 subjects reported AS and headache was the most frequent adverse event, followed by the muscle pain and tiredness. Most frequent body symptoms affected by AS was general disorder and administration site condition, 12% subjects; musculoskeletal and connective tissue disorder, 9% subjects; nervous system disorder, 8% subjects. Phase 3rd clinical trial, we can see in phase 3rd clinical trial, no serious adverse event on anaphylactic reaction was observed. Out of total 1800 subjects, 99 subjects reported AES. Most frequent observed AES were localized pain, redness, and swelling at the injection sites. Most frequent body symptoms affected by AES: general disorder and administration site condition, 11.88% subjects. No clinically significant abnormality was observed in laboratory result observed during the clinical trials. Overdose: no data is available on overdose with rabies Z protein vaccine. Pharmacological, we can see here in pharmacological properties, mechanism of actions. In the rabies Z protein vaccine, the virus-like particles self-assemble from the recombinant G protein, which is produced from genes cloned into baculovirus expressions vectors and expressed in Aspodiptera frugipreda insect cells. The interaction of the G protein and a specific cell surface reporter is involved in fusion of the rabies virus to the host cell membrane. The absorption initiate the injection process. The virus penetrate the host cell and enter the cytoplasm by pinocytes. Recombinant rabies G protein vaccine generate antibodies against rabies G protein and in turn affect virus neutralization as well as prevent virus attachment to the cell and confers protection against rabies. Big submit vaccine, there are no chances of reversals and rabies G protein vaccine as compared to inactivated vaccination. So thank you. रेबीज डिजीज बहुत ही डेंजर डिजीज होता है। जब भी रेबीज डिजीज होता है, इससे प्रिवेलेंस अगर हम ले लेते हैं, अगर हम इसका एट अ टाइम रेबीज वैक्सीन ले लेते हैं पोस्ट एक्सपोजर, देन ये प्रीक्यूबल है, इससे बचा जा सकता है। अगर हम रेबीज वैक्सीन एट अ टाइम नहीं लेते हैं, आफ्टर बाइट ऑफ एनी एनिमल पोस्ट एक्सपोजर, तो ये बहुत ही डेंजर और मौत तक ले जा सकता है। सो दिस इज द वेरी important invention in our practice. The only three dose is very effective for rabies. No, the patient को भी लगेगा कि नहीं, हमें बार बार नहीं जाना पड़ेगा, 3 बार में भी हमारा काम हो जाएगा और पेशेंट इस चीज को बहुत अच्छे तरीके से ले सकता है और उसको समय याद रहेगा। ऐसे हम जो भी देते थे 037 1428, उससे काफी अच्छा है, बढ़िया है, इसको प्रिस्क्राइब करें। If any questions? About rabies vaccine and rabies disease, then ask me.
First of all, thank you, sir. Thanks, Pramod, sir. First of all, many thanks to Dr. Parmod for their valuable speech, which was very presentable, and message is clear that 3-dose rabies is more effective as compared to 5-dose vaccine available in the market. On behalf of Cadila Pharmaceuticals and Travis, I thank you all for taking time out from your busy schedule to be a part of this webinar. Your persons has certainly enriched and evaluated the structure of this meeting. Kindly continue your valuable support for Travis, which is first time 3-dose anti-rabies vaccine. Thank you again.